So my name is Pam Jenkins. I am a registered respiratory therapist. Being a respiratory therapist, we specialize in any patients who have difficulties with their lungs, such as asthma, COPD, pneumonias, interstitial lung disease, which is a various of many lung diseases where patients have difficulty breathing. I would say at the first sign of any symptoms that you're not normally used to having. So if it's a runny nose and it goes away within like a week, then you're fine. But if you get a runny nose and then you get a fever and then you get shortness of breath, you really should go to the emergency room, and that is when you're going to see the respiratory therapist. Because you just can't say, oh, well, I want to see a respiratory therapist. We have to be activated by nursing or by the physician, and mostly by the physician. Because a respiratory therapist, we work under the direction of the physician. So the physician is our boss. They teach us, they guide us, they mold us to be just like them. We're like little baby doctors under the physician. So it would be if they're having problems breathing. So usually respiratory starts with like a basic cough, something as simple as that. And if the cough goes longer than, we would say in my world, 3 months, then they absolutely will seek a respiratory therapist. So if they're having shortness of breath due to the coughing, if they're having wheezing, which is a noise that most people hear in their chest when they have something wrong with their lungs. So it's a respiratory therapist who's going to help that person diminish their coughing, help them with their abnormal lung sounds, help improve their shortness of breath. So as a respiratory therapist, we treat, we educate, and we provide a resource to those around us. That's patient, family, co-workers, vendors, anyone in the community. It's such a broad, career position that it's not one thing that actually pinpoints being a respiratory therapist. Let's go for the hospital standpoint. So if we were in a hospital setting and a person comes into the emergency room and they can't breathe, then the physician is going to ask respiratory to come in. As a respiratory therapist, we go in, we meet the patient, we introduce ourselves, we let them know what we're going to do, and then we assess them. I would say the first and foremost is washing your hands. Oh my gosh, I cannot stress that enough. Wash your hands and don't touch your face. And stay away from people who are sick. And if you have symptoms, do not go around anyone who's sick. And if you have no choice, then wear a mask. That's the best advice. Make sure you tell everyone that you're sick. Stay hydrated, eat healthy, get lots of rest. If you don't have soap and water, then use hand sanitizer. But the basic thing, wash your hands. Don't touch your face. That's what I would say.